Hi, this is Cushing Who for the Week 9 video presentation. The system that I have decided to talk about today is the endocrine system, and the three major syndromes I have decided to talk about is hypothyroidism, hyperthyroidism, and Cushing's disease. So a syndrome is a compilation of signs or symptoms that are characteristic of a disease. So in hypothyroidism, it is an underactive thyroid gland where it cannot produce enough thyroid hormone. So lab results tend to show a deficiency of thyroid hormone, and hypothyroidism, it is mostly the symptoms and signs involved mostly associated with a slow metabolism. So this can involve a decrease in the basal metabolic rate, which can lead to weight gain. It can lead to an excess in vitamins. It can cause low energy or fatigue, and it can have a decrease in neuronal firing, which can lead to depression, dull thinking, difficulty concentrating, and hypothyroidism can also show signs of extreme sleepiness or constipation. Three diseases that produce hypothyroidism are Hashimoto's thyroiditis, congenital hypothyroidism, and endemic colloid goiter. So Hashimoto's thyroiditis is an autoimmune disease. So this is when antibodies destroy or inactivate the thyroid gland that causes hypothyroidism, and common symptoms are an enlarged or inflamed goiter and the thyroid gland area, so along the neck, and other symptoms relating to general hypothyroidism like fatigue and weight gain. Congenital hypothyroidism is a deficiency or complete lack of the thyroid hormone that's present at birth, and this is caused by either a complete lack of thyroid gland at birth or an impaired thyroid gland. So if a child's deficient, it can show signs of a protruding or swollen tongue, slanted features because of changes in soft bone, coarsening or dryish, yellowish skin. And if the child isn't treated with thyroid replacement therapy, you might see non-reversible delayed emotional, mental, or even physical growth. So endemic colloid goiter is caused by an iodine deficiency. So that's caused by decreased levels of thyroid hormone levels, and it can depend on where you live or your environment. This will also have signs of an inflamed goiter in the neck or thyroid gland area. Hashimoto's congenital hypothyroidism and endemic colloid goiter also do tend to show the general signs of hypothyroidism like fatigue, depression, weight gain, things like that. On the other hand, hyperthyroidism is essentially the opposite of hypothyroidism. Hyperthyroidism is an overactive thyroid gland and can commonly be where your thyroid gland makes too much of the thyroid hormones, such as the hormone thyroxine, which is also known as T4. Most of the symptoms are the complete opposite of hypothyroidism, so it can accelerate your body's metabolism, which can present itself as an increase in basal metabolic rate, which can lead to unintentional weight loss. You can have a vitamin deficiency, as the increase in metabolism can use up all of your vitamin resources. There can be an increased mobilization of fats from tissues, which can increase plasma levels of free fatty acids. Since there is a lot of excess fatty acids in the blood, you will need to worry about deposits in the body. So it can deposit in the arteries, which can lead to atherosclerosis, and the liver, which can lead to a fatty liver or steatosis. Hyperthyroidism can also increase neuronal firing, which can lead to extreme nervousness, paranoia, anxiety, or even extreme worry. It can lead to difficulty sleeping or insomnia, and Cushing's syndrome is caused by high levels of cortisol in your body, and cortisol is a hormone produced in the adrenal glands. Some of the hallmarks and signs of Cushing's syndrome is a rounded face, fatty hump between the shoulders, and purple stretch marks. It can result in high blood pressure, bone loss, and even type 2 diabetes. And Cushing's syndrome can have weight gain and fatty tissue deposits, especially in the face and shoulders, like I previously mentioned, and it can have a slow healing of cuts and infections. So the differences between hyperthyroidism, hypothyroidism, and Cushing's disease, all three of these can be detected with blood or urine tests. And obviously the blood and urine tests will have different things that pop up that indicate for hyperthyroidism, hypothyroidism, or Cushing's disease. So hyperthyroidism and hypothyroidism are both caused by changes in the hormone in the thyroid gland, whereas Cushing's disease is a change of hormone in the adrenal gland. So hyperthyroidism is an overactive thyroid, so it will have excessive thyroid hormone production levels. So commonly seen in blood tests and urine sample tests, there'll most likely be an increase in T3 or T4 or other thyroid hormone levels, whereas hypothyroidism, since it is an underactive thyroid, it will have a deficiency in thyroid hormones. So in blood and urine tests, there will be a decrease in T3 or T4 or other thyroid hormones. For Cushing's disease, this is an excessive cortisone secretion, which means there's going to be high cortisol levels, which you can detect with blood samples or urine tests.